DPS NCLEX Success Track Week 5 Physiological Integrity Part 2. Let's continue from Part 1 and Part 2 covers advanced pharmacology concepts, IV safety, and NCLEX style clinical reasoning. They covered basic IV therapy. Let's move to central line care and medication compatibility. Before connecting any IV line, scrub the hub for at least 15 seconds with alcohol. Use sterile technique when changing dressings and always inspect for redness, drainage, or tenderness. Before mixing or administering IV medications, confirm compatibility, particularly with antibiotics or electrolyte solutions. A single incompatibility can cause precipitate formation or inactivation, risking serious harm to the patient. NSU-LIN safety is one of the most frequently tested topics on the NCLEX. Memorize the major types and their onset times. Rapid-acting, such as Lispro, begins within 15 minutes. Short-acting, or regular insulin, begins in 30 to 60 minutes. Intermediate, NPH, starts in 2 to 4 hours, and long-acting glargine has no true peak and lasts 24 hours. When mixing insulin, always draw up the clear before the cloudy regular before NPH. Never mix long-acting insulin in the same syringe. These details save lives and exam points. Understanding normal and abnormal lab values allows nurses to detect early signs of physiological imbalance. Sodium levels range from 135 to 145, potassium from 3.5 to 5.0, and calcium from 8.5 to 10.5 mg per deciliter. Monitor for changes and correlate them with symptoms. Low potassium may lead to arrhythmias. Low sodium may cause confusion or seizures. And low calcium can cause muscle twitching or positive Vostok and Trousseau signs. Always report critical values promptly and anticipate replacement therapies. Postoperative care is all about vigilance. Always begin with airway, breathing, and circulation, the ABCs. Encourage early ambulation to prevent deep vein thrombosis, ileus, and atelectasis. Assess wound dressings for excessive drainage or foul odor, and report urine output less than 30 milliliters per hour. These small checks prevent major complications and demonstrate high-level nursing judgment. Safe management of medical devices is a major NCLEX focus. If you notice continuous bubbling in a chest tube's water seal chamber, suspect an air leak. For nasogastric tubes, confirm placement by checking for pH less than or equal to 4. For Foley catheters, always keep the collection bag below the bladder level to prevent reflux and infection. Device safety infection prevention. Nurses must quickly recognize fluid and electrolyte disturbances. Hyponatremia often presents with confusion and seizures. Treat with IV normal saline and fluid restriction. Hyperkalemia causes tall T waves on ECG. Treat with insulin and D50, followed by calcium gluconate to protect the heart. Hypocalcemia leads to tingling and muscle cramps. Treat with IV calcium. Fluid balance is the key to homeostasis, so always track intake, output, and daily weight. Next, let's review the 4 major acid-base disorders. Respiratory acidosis results from hypoventilation, as seen in COPD. Encourage deep breathing or use bronchodilators. Respiratory alkalosis comes from hyperventilation. Coach the patient to breathe slowly or use a paper bag. Metabolic acidosis occurs in conditions like diabetic ketoacidosis or severe diarrhea. Correct the cause and administer fluids or insulin. Metabolic alkalosis results from vomiting or suctioning. Stop the cause and restore electrolyte balance. Always interpret pH, PACO, and HCO together. In emergencies, nurses act first to preserve life. During shock, place the patient in a Trendelenburg position if tolerated, administer oxygen, give IV fluids, and monitor urine output closely. In anaphylaxis, secure the airway immediately, administer intramuscular epinephrine, and follow with fluids and oxygen. For cardiac arrest, perform high-quality CPR 30 compressions and 2 breaths, at a rate of 100 to 120 per minute, with a depth of 2 inches. Always call for help early and use the AED as soon as available. Long-term conditions require consistent nursing attention. For diabetes, check blood glucose before meals, educate on insulin use, and treat hypoglycemia promptly. For heart failure, monitor daily weights, restrict fluids and sodium, and observe for edema and shortness of breath. In COPD, use low-flow oxygen, encourage pursed lip breathing, and promote energy conservation. For stroke patients, use the FAST assessment: facial droop, arm weakness, speech difficulty, and time to call 911, and prevent aspiration with safe swallowing practices. To conclude, always apply clinical reasoning to each NCLEX question. Assess the situation first, identify the highest priority based on ABC's or Maslow's hierarchy, implement the safest intervention, and evaluate the outcome. Expect question formats like SATA, case studies, ordered responses, and hotspots. Focus on what action the nurse should do first, what is safe, and what requires immediate follow-up. This concludes Physiological Integrity Part 1: Basic Care and Pharmacology. In this module, you learned how nursing care, medication safety, and clinical reasoning preserve physiological stability. Every turn, every dose, and every assessment contributes to the patient's survival and comfort. In the next module, we'll continue to Physiological Integrity Part 2: Risk Reduction and Adaptation, where we'll explore more complex physiological changes and acute care priorities.